In this video, I want to talk about dental cavities, what dental cavities are, um, how you can prevent dental cavities from developing, and how you can restore dental cavities if you develop a cavity. Now, a lot of cavities can be prevented if you go to the dentist every 6 months, or if you brush and floss your teeth every day. You can prevent a lot of cavities. Now, a lot of people, for whatever reason, they'll neglect their teeth, and when that happens, then they develop cavities. And if you don't do anything to fix those cavities, then those cavities can get big, where you might end up needing a root canal on a tooth, or you could possibly end up losing that tooth, having it extracted. So you want to prevent all of that. So the best thing to do really for that is going to the dentist every 6 months, depending on your case, and then cleaning your teeth every day, brushing and flossing your teeth every day. If you do those things, you should keep your teeth in good shape, and you should prevent the majority of cavities, right? And then also your diet, as far as how if you eat a lot of sweets, that's what the bacteria uses to metabolize that food, and when that breaks down, it causes acidity on your teeth, and that's what causes these cavities. Now, let's say you have developed a cavity. How you're going to be able to know this? Typically, there's going to be a hole in your tooth, kind of like maybe this here little hole that I'm pointing to here, or little here. And sometimes you may be a little sensitive. Let's say you're trying to eat something at home, and you feel a little sensitivity on your teeth. Then you might know that you have a cavity. And sometimes you may have like a little black hole on a tooth that may show up like on the surface like this. Now those are going to be hard to tell because typically you're not looking in your mouth to see if you have a cavity somewhere. Even if you are, it's very difficult to look in some of these areas to see if you have a cavity. Now, if you do develop a cavity, and then you first of all you want to you want to go to the dentist, get an exam, and the dentist is going to take an x-ray of your mouth. Once they take an x-ray, and then they'll be able to diagnose from that x-ray how extensive your cavity is, because if it's just a small one right here, we can clean it out and fit it with composite material or amalgam material. If it's too deep in, we may have to do a crown. So instead of just a filling like this here, I'm sure this is a demonstration here where I actually use this one in dental school. You remove the cavity and then you fit it up with amalgam. This is metal material, a mixture of metals that used to be used in the past, and some dentists, I'm sure, are probably still using them today. Not recommended, but some people prefer these because they last a very, very long time. So you remove this tooth structure here, remove that, and then you pack it in with amalgam or composite material, kind of like this here, which is a little bit more aesthetic because it's white. It kind of matches the other teeth, and patients typically tend to like these better. Now there's been talks about these silver fillings. This is a demo again. You have one here one here, then one here that they cause mercury toxicity in your mouth, which can lead to other illnesses such as Alzheimer's and whatnot. Now, whether that's been substantiated by science, I don't know, but what I know is that they do last a long time when you restore teeth with these amalgams. So the most important thing that you want to do to prevent these cavities is brushing at home. Make sure you're brushing in the morning and you brush at night, and then floss. Make sure you floss. And these areas in here are very susceptible to cavities because they're very hard to reach. You cannot reach some of these areas, especially right here in the interproximal areas. It's very hard to reach in there and brush. So if you're brushing like here, your toothbrush only reaches so far, right? If you're brushing like this or you're brushing like that, it's very hard. And because a lot of people don't like flossing, that you can get in there and floss like that to remove all that plaque that builds up in these interproximal areas. These are areas that typically tend to develop cavities in the mouth. So when you go to the dentist every 6 months, what we're going to do is do some bite wings, what are known as bite wing x-rays, and that's going to show us to see if there's any cavities that are developing in the interproximal areas there. Now, when we've found one, with the procedure is that you come in and then we'll determine what kind of cavity you have. It may be in these back teeth here, it may be in the anterior, in the interproximals right here. We will remove that. We'll numb you up first, and then we will remove that. We'll remove that cavity and then fit it up. Now, there's many steps to that. I'm not going to go into all of that in this particular video here. We'll have to make sure that this is nice and flush, because when your upper and lower teeth are biting, you don't want something being too high. So in the surface, so let's say you did a filling here and you left it too high, then this jaw is not going to close all the way. So what you want to do is make it flush and nice, remove all the excess material from around here, polish it up nicely, make sure that the patient can floss, that they can floss, and you want to be able to hear a pop when that happens, so that because sometimes if you leave these areas open, then that also can become an area where the patient begins to pack a lot of food, and that can cause periodontal disease that causes your bone, where you can lose your bone, or inflammation. You can have gingivitis if the contacts are not correctly done. But a lot of this actually just falls really on the patient's side, where your best remedy is brushing every single day, and then flossing every single day. If you do that, you should prevent most of the issues that can come from a dental standpoint. Now you can develop a cavity on the occlusal surface here of this tooth, or it could be just on a cusp. This is called a cusp. That's another cusp. This is another cusp here. It could be in the pits here. They also like to be here in the pits. Again, in the interproximals here is where they also tend to be. So we'll get in there and remove it out. And you can have them very in the lingual part of these anterior teeth, or like right in here, and then we'll dig it out and then fit it with composite material or amalgam. I don't do amalgam in my office. I did them when I was in dental school, but we don't do those anymore here. You can have them in the lingual part of these molars here. You just have to remove it out, and then fit it in. They can be in the cervical, right, in those areas. Then these typically tend to be very, very difficult to fix because the gum is typically very close to that, and removing this is very, very challenging for a lot of dentists. And then you have to get in there and then fit it up. And typically there's saliva in this part, and then if there's gum, you may bleed a little bit. So these are very, very difficult. This is why you want to make sure you're brushing daily and flossing. You can also have them develop, on the buccal areas here. They can develop there, and then you just have to get in there and dig them out and then fit them up. They can be on the cervical, on the buccal here. And then we have to fix them up in the anteriors. You can have what are known as class 5s as well. They can develop here. We fit them out. So the best remedy for these is just going to the dentist every 6 months and getting your teeth cleaned and flossing every single day, because if you do those things, then you're gonna be fine. And then if the cavity is too big, then instead of just filling it like this, and now this is amalgam like I've already said, or let me use a composite one. Here's a composite one, a white filling. If it's too big, then what we'll do is we'll shave most of this tooth here, remove all of this, and put a crown on the tooth. Now, a crown protects the teeth. Some people don't like that idea, but crowns really last a very, very long time. I have some patients of mine that I've had crowns for 40 years. They last a long time, as long as you're following the protocol of what you ought to be doing, which is brushing every day. Brush the occlusal surfaces of your teeth. Flossing. You should prevent this. And now, so just do those things, and you're gonna be fine. Now, some of these, as you get older, you may want to replace with actual crowns, because again, crowns just much more durable than the material that we use to make crowns out of. They're just very, very durable, and they can protect that tooth, and you can eat, chew, and floss and everything with them. So that's why I like crowns for some of my patients that may have some cavities. So anyways, I hope this video kind of helps you understand a little bit about dental cavities. And if you need one, please come to our office, and we would love to help you out with your dental needs. But again, the best remedy for your teeth is a good old toothbrush. Some people like, manual toothbrushes like this. Some people like electric toothbrushes. Whichever one you prefer, just make sure that you're brushing your teeth. And most importantly is that you floss your teeth every day. If you do that, you're going to prevent all of these issues. Our goal, or my goal, at least in my practice, is that I would love for people to run us out of business because there's no more cavities or no more crowns to do. But if you do these things, you might contribute to that. But I care about this profession very much, and I want everybody to have good teeth, so that you're not losing teeth because due to bone loss, or cavities that you can prevent, or if they do develop, then get them filled quickly so that you don't have to spend more money on something more costly. And if you do those things, you're going to be fine. So anyways, again, if you need dental work done, come to our office. We're based in Dallas, North Dallas, and we have a small practice. We just love our patients, love treating them and preventing any dental issues may develop. So anyways, give us a call, and we would love to help you out. Okay, thanks, bye.